Are we all moving our bowels every day? I bet this is the only show in America that starts by asking that question. Poop Doc's president, Scott Olsen, is here today, and he's going to teach us a little bit about how to get the bowel working again. For so many, it doesn't work. Dr. Soraya is here toward the end of the show. Here is a pulmonary specialist and internal medicine, board certified in both, who says fungus is in the lungs of most of our patients. I'm going to teach you a little bit, therefore, why we are overdiagnosing cancer. And then Nurse Jenny Herbachik is here today to talk about AGE, not your age, but something you're eating. This program is brought to you by Poop Doc, the #1 place for the #2 problem. My name is Doug Kaufman. For the past 40 years, I've dedicated my life and even my career to finding the root cause of disease. Join me and a team of physicians, pharmacists, and scientists, and soon you too will know the cause. We're talking to Scott Olsen of Poop Doc. The name of his company is Poop Doc. What a name, first of all. I don't even want to delve into how you came. I know how you came up with it.
That's right.
It was really brilliant. But folks, this is important to understand because there are varying degrees. All of us talk to our doctors, there are varying degrees of constipation, diarrhea, indigestion, GERD, So Scott, with the 3 products you have developed, you've got your fiber mixed with all sorts of good antimicrobial ingredients, and then what I call the blasting cap, your organic magnesium. That's #1, and then number 2 is the fiber, and number 3 is the probiotic. Since there are varying degrees of, say, constipation, some people watching right now may say, I go every 4th day, and that seems to work for me. But the scientific literature tends to lean on we should go every day. Where does a person get started? I know all I take is your fiber, right? I've always been fortunate. And the probiotic is necessary across the board. How do I get started on your product? How do I know how constipated or how much fiber I need?
Well, that's a really good question. You and I really need just the fiber because we've worked at our health many, many years, and we're blessed with regularity.
I think we also need the probiotic.
Oh, yeah.
On a daily basis also, maybe just before you go to bed at night.
Absolutely.
Especially what you've put together here is kind of exciting. So we take the fiber.
That's one thing I do not go without.
Okay.
The probiotic and the fiber, but there are people that call us every day all over the world. I can't go. I've tried everything. Over the counter, under the counter, prescription. I've seen specialists, gastro specialists, you name it. I'm a throwaway. Is this really going to work? I said, yes. They send it. I said, when you get it, if you have any questions, give me a call. Where do you start? Most people that call us are going once every 3 days. Right. We have people that go once every 10 days. Once every 15 days, once every 20 days. My record is one girl, 32-year-old, that went once every 5 weeks.
Do they share this? I mean, this is kind of, like you have always said, you don't wear a T-shirt, I'm constipated, let's talk about it, right? This is kind of private information, but they're so comfortable. I have 2 friends who I've sent to you, and they're so comfortable. Something about Scott just bleeding your heart and telling him, but it doesn't last that way. She isn't going every 5 weeks now because of your product.
Every single one of the train wrecks,
right,
which means people gave up on them. The professionals gave up on them, are going 1 to 2 times a day.
Yeah, and that's what I hear all the time with this product. Folks, there's one thing. You can walk into any health food store, any pharmacy today, and you've got a choice of 55 different fibers in there. When all else fails you, then people turn, and that's why I love the name. Boy, do I remember Poop Doc. What is it about your formula that's different from all those other 54 products?
Well, the Formula 1 is our #1 seller because it's the only thing that works for constipation, and I mean severe constipation.
This little guy right there.
Right.
Yeah.
We have a proprietary blend, and of course, there's been people that try to figure it out, but they haven't. And that works when nothing else does.
Do you take a capsule? Let's say I go every once a week.
Okay.
Do I take a capsule at night before I go to bed of Formula One?
So say somebody calls and go, look, I've gone every 5 days for the last 3 years. What should I do? I always ask them about the basics. How much water are you drinking?
Right, good.
What's your diet like? What's your stress 1 to 10?
Yep.
You know, you can't miss the basics because we want people to be healthy.
Yeah.
The other thing is start with, if you're going once every 5 days, start with 5 caps a night. You have to have a starting or a launching place. Start somewhere. You take it before bed. Why before bed? Because the elimination cycle of the body is between 4 a.m. and 11 a.m., so we want to work with the body's natural cycles.
So you're saying if 5 days, start with 5. If you go every 4 days, maybe take 4.
Right.
If you go every 3 days, maybe take 3, and
Right.
so forth. Okay, now, boy, we have broken all the boundaries in talk show. You know, this is something that I remember 20, 25 years ago on radio, we couldn't even talk about this. I mean, it's amazing. Thank God we're able to talk about it now. You know your cycles, your intestinal cycles. Maybe today's show will be just the show you needed to see. We know about antibiotics. What do we really know about probiotics or replenishing of those good bacteria? Don't go away. Scott's going to address that when we get back. So Scott Olsen, the president of Poop Doc, joins me right now. We spent the first 5 or 6 minutes kind of introducing you to what seems to go awry in the gut. Scott, it was only 10, 12 years ago that this magic pill that was, you know, a certain color could be swallowed and it would take care of what we call GERD, gastroesophageal reflux disease. And so it became the darling of Wall Street. It was the next antibiotic, right? Now millions of people are on these acid blockers, and there's a downside to that. Why isn't anyone addressing the cause instead of the effect?
You know, I've actually read about a guy that's got a TV show called Know the Cause.
I got to meet this guy. He's hit that dead on. Know the cause. It's our diet, you guys. It's our soda pop. It's our alcohol. Alcohol is a mycotoxin. And then we expect to get up every morning and go to the bathroom 3 times a day. It doesn't happen that way. And when you're blocked up, you're kind of miserable, but it isn't something you go to a tea party and talk about. And so we elected to take a few minutes today and talk about it. Your products service the gut and restore the terrain of the gut. What happened to the good terrain?
Most people do not realize that the food that we're eating, laced with antibiotics, because 3/4 of all the antibiotics in the United States are sold to feedlot animals. And last night they probably had a little antibiotics with their meat.
Yeah, with
for dinner.
chicken, with steak, etc.
Yeah.
And that isn't every once in a while. We tend to eat meat a few times a week, and that just backs up and may erode the good terrain of the intestine. We don't really care on Know the Cause how it got there. We want to identify that's a problem and then fix it. Instead of running to the doctor time after time and doing the scopes and so forth, why are you blocked? What can you do about it? When I was working in clinical nutrition in years past, I always told people, look, get some fiber, put some psyllium in. But then reading the scientific literature, even the psyllium can kind of bind in the intestine, which I love what you added to yours. Tell the
Right.
people about how yours is different.
We added natural and anti-inflammatories, which calm and soothe, blended it with a blonde psyllium, so you get very smooth transition. Once that's calmed down and you got smooth, easy transition, you got good production, you're in and out of the bathroom in minutes. It's not like just taking pure psyllium. It's night and day difference.
And then finally, you put together a product you call Formula 3, which is a unique probiotic. How important is that if we've ever in our life been on antibiotics?
I've been doing this about 15, 16 years. Life and death begins in the colon, in the gut. Hippocrates said, the father of medicine. If you get the elimination channels open and you restore the gut terrain, a really good, effective probiotic, and then you have good nutrition, get some exercise, and the right diet, which you teach better than anybody else, I believe it is one of the fastest pathways to health there is.
And I love exercise also.
Yeah.
I always tend to think when I'm doing my, my little maxi climber and thing, that I'm moving things down, right? I'm shaking things up.
Yes.
They have this little device now, an exercise device that you stand on and hang on, and it bounces you. And I think, okay, that's pretty good. It's compacting me down. Now when I go to the bathroom. But folks, this is not private. This is out in the public, thanks to Know the Cause and Scott's company, Poop Doc, and so forth. We're not moving our bowels like we should.
No.
We blame it on, okay, but I'm overweight. Okay, but I'm 70. Okay, but I'm... Look, don't do that anymore. Understand your diet, past antibiotics, past alcohol, may have a lot to do with it, current diet. So get it working. You've got formula 1, 2, and 3. Number 1 is the fiber. Boy, I take this every night before I go to bed. Stir it up. See that little stir? That's going to come to you too, this little stir. Formula 1 is what I call the blasting cap. And then formula 3 is the probiotic. And folks, he's got a formula here. If you don't go to the bathroom anymore than once every 4 days, start with maybe 4 of the number 1 formula, this guy right here. Every 3 days, start with 3 of those a night before you go to bed. Every 2 days, 2 of those, and so forth. And eventually you can wean off that and just on these 2. Good to see you. Thanks so much for coming in and continuing our education. Poop Doc, love the name. Let's see if I can get this right. Advanced glycation end products, or AGEs. What is their role in cancer? Watch Nurse Jenny right now.
Hi, I'm Jenny Herbacek with the Cancer Connection. Did you know that how we prepare our food can make a major difference in how healthy it is for us? Studies have shown that foods cooked or processed at high temperatures can cause a release of harmful advanced glycation products called AGEs. And these can damage DNA and increase our risk for cancer. For example, research showed that breast and prostate cancer sharply increased by those who were eating heavily cooked meats such as well-done burgers, processed foods, and fast food. A lot of restaurant food is high in AGEs, so lightly cook your vegetables and don't overcook your meat, fish, and chicken. Another helpful strategy would be to use acidic marinades that contain lemon juice or apple cider vinegar before cooking. This will limit the AGE formation in your food. For Know the Cause, I'm Jenny Herbacek.
You know, many years ago I brought you this report, 1995 it came out. Fungus of the breast diagnosed by fine needle aspiration. I'm telling you, we are grossly overdiagnosing cancer in America because it's difficult to differentiate between a sac fungus and a tumor, right? So in this presentation, these women were diagnosed with breast cancer. They went in and did a fine needle aspiration, a little tiny 23, 26 gauge needle, pulled out some of the cancer tissue, sent it off to a lab, and they grew it out in culture dishes, and all 3 women had fungus. 2 of the 3 went on antifungals and got better, and the 3rd was still on the antifungals. They didn't have a chance to complete it. Here's why I bring this to your attention. This came out a couple of years ago. Are we overdiagnosing cancer? Now, this is in English, so it's a little difficult to read. English with a capital E. This is from England. Female patient discovered a hard lump in one of her breasts. At a Swedish hospital in 2012, the diagnosis of breast cancer was determined, and quite soon thereafter, the breast was surgically removed and chemotherapy was started. Do you hear that song, The Hustle? Do, 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 do. Boy, that's breast cancer, get her in quickly. Wait a minute, I've had that breast 40 years. Could we slow down a little bit? Nope, you gotta get to the best surgeon in the country and get the breast taken off, okay? In connection with the operation, this is a doctor talking here. His name is Enby, Eric Enby. In connection with the operation, I managed to get 6 samples, cancer samples, that had been prepared at the Department of Pathology at this hospital in Sweden. I could immediately see the samples consisted of spore sac fungi. These are called ascomycetes that grew in the sample, which as a whole appear to consist of such a fungus. Keep going with me. One of the professors there argued that what was seen in the sample were cancer cells. But this guy said, no, I don't think so. For those who don't know anything about, do not have any experience in mycology, the study of fungus, which fortunately Dr. Enby did, this doctor didn't. It is almost impossible to understand how anyone can argue that a cancer tissue, as in this case, can consist of a spore sac fungus. What did I teach probably 3, 4, 5 years ago? I had Dr. Richard Ablin in. He's the doctor that discovered the PSA protein. Millions of men have given their blood, and some of them, boy, your PSA is over 4.0, you got cancer. But then it was Dr. A.V. Costantini with the World Health Organization that said, wait a minute, what they're actually testing for in the PSA test is antibodies in a man's blood specific to 5 different sac fungi. So is the PSA test a fungus test? I happen to believe it is. Are we calling everything cancer, folks, for cancer's sake, for treatment's sake? He finishes this by saying, this in a journal called Third Millennium Science, kind of a neat journal, in April 2013. What in this case by routine was classified and described as cancer can very well be fungus or mycoses. We are running from doctor to doctor to doctor. But the second we get in the shower in the morning and feel under our arm or a breast or something and feel a knot, boom, off to the doctor we go. What they do is take a biopsy, not fine needle aspiration. Folks, if that's an ascomycete, if it's a sac fungi living, these fungi are living in a sac, and you poke a hole in it, what's going to happen to the spores, to the fungi themselves? They're going to get out. And I don't think it's coincidental at all that fungi thrive in warm environments. So here's the breast, and here's under the arm. So when you put your arm down, you have an axillary temp of what, 98.6, 98.4, something like that. It's hot under there. So away those little microbes go under the arm for some protection because it's very, very warm. Now you begin to feed them. A little glass of wine or two in the night, what's that gonna hurt? A lot of grain, what's that gonna hurt? Peanut butter, what's that gonna hurt? Under your arm, they now go and they do a cut down and they see all of these cells that are cancerous, right? Went from the breast to under the arm, and they're calling them cancer. This woman didn't have cancer. These 3 women didn't have cancer. When you go to the doctor because you have a lump in your body, he's looking for what? Fungus? No way. Didn't learn that in medical school at all. It's interesting that the opening sentence in this, fungi infections of the breast are unusual and may clinically mimic cancer. They're not unusual. I'm telling you, I think they may be, I think it might be normal. I think it might be normal to have fungal infections of the breast, and we're calling 100% of them cancer. It's not normal. It's abnormal, but it isn't cancer in many cases, okay? I hope you understand now. Okay, now, not for my sake, but for your sake, I'd like a physician who really understands mold, mildew, and fungus, who didn't maybe a year ago, but he was leaning that way. Dr. Mukesh Saraya and I met 9, 10 months ago, and you attended a conference that I was speaking at. And I'll never forget, Dr. Saraya, you wrote me this little e-note on Monday, this email, and said, I think my life and my practice has changed. What happened during that seminar that changed you?
Well, Doug, it was just an amazing experience. And, I'm a pulmonologist. I've been in practice for about 27 years. And you could consider me to be a very aggressive pulmonologist in the sense of, trying to get to the root of the problem. So when my patients come in coughing, sometimes for months and years, and are not getting better, I've always kind of looked for the cause, which is kind of do a bronchoscopy, figure out, what is going on and what the cultures were revealing. So more and more, I was seeing evidence of fungus down the lungs, much more than bacterial infections, much more than viral infections. So as I sat through the conference that you invited me to on mycotoxins, and I listened to your keynote speech, it occurred to me that what I was seeing in my daily practice was what you were talking about. And it's just amazing because typically fungi, by standard medicine, conventional pulmonologists, are considered to be nothing more than an irritant, nothing more than a colonized bug that does not need to be treated. And I was of the same mind frame to a certain extent. Now, I had been treating, with antifungals when I find an overwhelming infection, pneumonia, things like that. And typically that's when standard, treatment, medical, treatment would be, is to consider it to be a contaminant and treat when somebody's immunocompromised, like they have cancer, they have AIDS, HIV. That's when you would kind of be treating it. But the more bronchoscopies and the more cultures I was getting, the more puzzling it was becoming as to what was the importance of this. And as I attended and I sat through this conference that you graciously invited me to, I started putting things together, in terms of what I was seeing with my patients. That was actually the cause and the source of a lot of people's problems, symptoms, cough, congestion, not being able to move from one room to another. When I would do a bronchoscopy, I would literally pull out plugs and plugs of mucus, sometimes measuring up to 10 centimeters in length. I would literally have to kind of flush it out of my scope in order to, and then it would grow nothing but fungus. So in my opinion, these were not just a pathogen sitting there. I think this was the fungus, the fungi, such as Aspergillus, Penicillium, Bipolaris. And then, as we kind of reshaped, what I was looking at, we started looking at the environment. We started looking at the foods that patients were eating. And over the last, I would say 2 or 3 months, as you provided me with your fungus link on the audio, I think that was the best. The other thing I texted you the other day was that this was the best CME in 27 years that I've ever had. Wow. And basically chapter by chapter by chapter, as I'm reading through, as I'm listening through, it's beginning to occur to me that little tremor that patient has. I've had young patients that have, while I'm treating them for Aspergillus, are having heart attacks. I'm beginning to see that link that you're pointing at, that this is probably not a coincidence. Last week, we had a patient being treated for Aspergillus, ended up having a big tumor coming out of her rectum. And literally, it looked like a polyp to start with, looked like, and in fact, the gastroenterologist, looked at that and said, this is probably a hemorrhoid. And then as she was showing me the progression of her pictures, I'm beginning to kind of see the link, between what I'm treating and what else is going on in that patient.
This is a doctor, folks, who has always been into nutrition. He has a fascination. He's got 2 daughters that are physicians also, so long medical background in the family, who typically would do a bronchoscopy, and maybe the standard is just put the patient on an antibiotic and get them into the hospital from time to time. That no longer takes place. I want you to know that Dr. Saraya's practice has totally changed. He is in Denton, Texas, out in my neck of the woods here. Thank you for coming in and continuing our education. It's one thing to hear testimonials from a patient, a whole nother thing to hear testimonials from a physician. Thank you for your time.
Well, thank you for the knowledge you've imparted to me.
Wow, Dr. Saraya, that's just mind-boggling. When one doctor gets it, his patients benefit, every one of them that come in. Thank you to Scott for coming in today. Scott Olsen with Poop Doc. This is get the bowels working again, clean them out, right, and then restore. The 1, 2, and 3 formulas, and of course this little stirring wand, I love this little thing, comes with it when you buy all 3. Folks, I really appreciate you guys sticking with me and learning about this. When this is working, everything works. Thank you, Nurse Jenny, for AGE education. What did you think about, are we overdiagnosing cancer? I certainly believe we are, and I hope you do too. God bless you, folks. I'll see you next time. Bye-bye.